Good afternoon, everyone. This is Alice with the Carbon Chamber and Economic Development Corporation. We're going to start our program in just 2 minutes as we let the rest of our guests join the room. Hello and good afternoon. Welcome to today's virtual tour of the new St. Luke's University Health Network Carbon Campus, a project that has been years in the making. I am Alice Wanamaker with the Carbon Chamber and Economic Development Corporation. We, along with our partners at the Greater Lehigh Valley Chamber of Commerce, are proud to bring this webinar to you today. We appreciate you joining us as we welcome and introduce you to the new St. Luke's Carbon Campus. St. Luke's University Health Network is a leader in healthcare, winning several awards, which we will hear about in just a few minutes. A few housekeeping items for today's webinar. This webinar is closed. No one can see or hear you. This program is being recorded to be shared with our presenters later. And remember, if you have any questions throughout today's program, use the Q&A box and we will get to them at the end. I wanted to thank all of our board of directors and supporters and sponsors for being on today's webinar. I have had the pleasure of getting to know our first speaker over the last 2 years, and I can tell you this, John Nestle is a man of his word. He has committed to so much more here in Carbon County than what we are about to see, and I can only wait for the new hospital to open. Ladies and gentlemen, President of the Carbon and Lehighton Campuses of St. Luke's University Health Network, Mr. John Nestle.
Thank you, Alice, and thank the Chamber for the opportunity to give the community an update on the great things happening in Carbon County in healthcare. And it occurred to me that it was only about 3 years ago that the Blue Mountain Health System Board made what I think was a historically great decision to join the St. Luke's Healthcare Network. And it's interesting. I've worked all over the country with a number of different systems, and there's a good way of merging, and there's a not so good way of merging. And I think St. Luke's, of all the networks I've seen in the country, does it the best. There's this fundamental belief that healthcare, comprehensive healthcare, should be local, that a local community should be able to take care of the sickest patients, the highest acuity patients. And so for the last 3 years, this fantastic team that you're all going to meet today, we've been working hard to deliver that to the region. And as we go through this model, what will be emphasized over and over again is we don't want people to travel for care. And that's just not a convenience. There's certainly a lot of research that shows if someone has to travel for care, quite often they don't get the care they need, and problems occur, delays in diagnosis. And so healthcare issues happen that don't have to happen. So it's a quality issue. So we're very passionate about this. So I'll walk you through some of the elements of what this comprehensive approach is to Carbon County, and this belief that it should be rare to leave the county for care. So let's get into the elements. And as fabulous as this new medical center is, and honestly, I don't think this is hyperbole. This is one of the most innovative medical centers that we're about to open November 20th in the country. And that's from a high-tech perspective, it's from a physician and nursing perspective, and it's also from a high-touch perspective. But there's a lot more going on than just this fabulous medical center. And it does start with a commitment to quality. And every community hospital that joins the St. Luke's network gets the benefit of massive recruitment power of talent, but also tremendous educational systems and development of people and the best practices in clinical protocols. And so we have some data for you later in the presentation that shows that over the last 3 years, the hospitals in Lehighton have progressed at the top 1% in the country in the rate of improvement, not just in clinical quality, but patient experience and employee engagement. And we measure all three. And we're on our way. We truly are on our way to being a top 100 hospital in the country in Carbon County. And then secondly is this commitment to accessible outpatient care, primary care. And we've worked hard in Palmerton, for example. We now have 3 new outpatient facilities that provide pediatrics and obstetrics, urgent care, primary care, all various specialties. So there's very, very comprehensive care on the main street of Palmerton today. And we've done the same on 9th Street in Lehighton. We're expanding services in Jim Thorpe. And we now have 16 outpatient sites with family practice and other outpatient services spread throughout the greater Carbon County area. And that's critical because that is how patients usually access the healthcare system. That's where the care starts. And the distribution of these sites is incredible. And then the third bullet on this slide is recruitment of specialists, of medical and surgical specialists. And again, the St. Luke's philosophy is it shouldn't be specialists coming up from the city a couple of times a month as a satellite. We have recruited dozens of new specialists based in this county, working here, living here, playing here, committed to the county, and the quality of people is spectacular. We're recruiting young people from all over the country, from the best medical schools, the best medical residencies, who could go anywhere in the country. And they're choosing to join the incredible story that's playing out in Carbon County. Next slide, please. So regarding this new regional teaching medical center in Franklin Township, which will be opening on November 20th, this is a commitment to care for the sickest patients, the highest acuity patients. So in the hospital, 24 hours a day, 7 days a week, there will be intensivists, critical care specialists, not on call, in the hospital, that are specially trained to take care of the most acute patients. And of course, they're backed up by the cadre of medical and surgical specialists that I referenced earlier. So a very comprehensive network of providers across all specialties, so that again, care is local, people have access to the best in healthcare, don't have to leave this county for care. And then the second bullet is we need to think of this as a regional teaching hospital. So there will be dozens of medical students training at this hospital, dozens of medical residents and medical fellows, and nursing students and other healthcare professionals. This is a major teaching hospital. And that even further enhances quality. Research shows that. But maybe more importantly, this is going to be a resource to this county for generations to come, for healthcare and medical talent. And then the third bullet references the great stuff that's going on at the existing medical campus in Lehighton. Just as excited about it, quite honestly. We have been and will continue to make major investments at the Lehighton campus to take on the challenges of behavioral health. This is evolving as a center of excellence for behavioral health that we think also will get national recognition for the comprehensive nature of the care provided at this site. A dramatic improvement in access, in resources and quality to take on the challenges of mental illness and behavioral health issues in our area. And also that campus will continue as a center for post-acute care and acute rehabilitation services. So incredibly bright future for the existing Lehighton campus. Next slide, please. And we want to emphasize the regional nature of this medical center. Our team has been all over not only Carbon County, but the 4 counties that are contiguous to Carbon County. And we're getting very strong feedback that this will be a regional draw. There's about 180,000 people that live within a 20-25 minute drive of our new hospital. And we do believe this region will see this medical center as their high-end regional teaching hospital. And that means great things for healthcare, but it also means great things for the county in terms of economic development and growth. Next slide, please. So this is a nice summary. It gives you a snapshot of the great progress in Carbon County. When Blue Mountain joined the St. Luke's network, slightly less than half of the care provided to residents of Carbon County went to St. Luke's providers. The latest number is 70%. So that to us is a vote of confidence in what we're doing, even prior to opening this new hospital. We have experienced tremendous growth at the existing campus because of all the great things happening with recruitment and development of people and quality systems. So we're on our way. As we open this new hospital, we're moving in with a great culture and great quality and great growth and great financial health. You can see the growth percentage, 20% a year growth. And we've gone from an operating loss to a nice gain, and that's important. That provides a stable employer. That provides stability to the community. Excuse me, if I would have, I'm getting a call as I'm presenting. I apologize. And that provides great stability to the region and to the community. And then the next 3 numbers give you some of the report cards that I referenced earlier. IBM Watson is a very comprehensive rating system for hospitals that looks at all aspects of performance, everything from growth to financial performance to clinical quality to patient experience. And you can see we launched ourselves from 20th to 75th percentile. We think we're on our way to the top 100. We truly do. Leapfrog is another quality rating system. A few years ago, as Blue Mountain joined St. Luke's, it was a D grade, and we are now an A grade, the highest grade. And that is a tribute to the great employees, the great staff, the great physicians, and all the wonderful quality protocols that St. Luke's introduces into a community. And the same thing happened with the Medicare Compare data, from a 2-star to a 4-star. Next slide, please. We're thrilled that the Times News Reader's Choice Awards, almost all of the healthcare categories were awarded to St. Luke's, including Best Hospital, and you can see all the other listings. So this is another nice vote of confidence that the community has placed in St. Luke's. So we thank you for that. Next slide, please. Then finally, the economic impact. When I add up all the investments that I referenced earlier, not just a new hospital, which by the way, we're already about to expand it. Just as we open, we're going on to a phase 2. But all the investments in the existing campus and in the outpatient sites, it's over $200 million that St. Luke's has committed to provide high quality, comprehensive care to the greater Carbon County area. And on an ongoing basis, we have an estimated impact of $250 million per year in not only direct care, but all the suppliers and businesses needed to support a hospital of this magnitude. And again, our commitment to education and developing people and developing talent in this county. We had the superintendents over to tour of the schools, over to tour the hospital recently. And we've always been interested in developing young people, mentoring young people. That's only going to expand in the coming years. And of course, as we bring new employees, hundreds and hundreds of new people, physicians choosing to live, work, and play in Carbon County. So with that, I will, next slide, please, turn it over, I believe, to Mr. Pinto, who will take you through some of the details of the spectacular new campus. Thank you.
Thank you, John, and thank you to everybody attending. Thank you, Alice, for having us here today. And I'm just thrilled. I mean, John shared the vision there with everybody, and I get to fill in some of the details here, including taking you on our virtual tour. But before we show the video, I just wanted to say, give a little bit of a couple of statistics about the new hospital. So our new hospital is 160,000 square feet of, as John said, the most technologically advanced hospital in really in the country at this point. We are on 110 acres of, as you can see in that picture, gorgeous, beautiful land with the most amazing views from literally every single window in our new hospital. So without any further ado, let's share the video, and I'll fill in some details after the video is over. All right, thank you, Alice. Boy, it's gonna be hard to. That's a tough talk about a tough act to follow with that video, but I'm just so again, it's just so excited to share some of the more, the details. I'm sorry. Some of the details of the actual hospital itself, and let's start off with our capabilities. And first and foremost, our capacity. So we have the capacity for 80 acute care rooms. We will be starting with actually 40 acute care rooms, and we feel that we'll be getting to the 80 very quickly. We'll have 3 ORs day one. We'll have 2 procedure rooms as well. We have, as John mentioned, this is very important. I just want the folks on this call to really understand how important this is. But we'll have 12-bed ICU with 24-hour critical care coverage, and we're going to talk about in the subsequent slides the firsts, and this St. Luke's being the first, certainly at St. Luke's in our network to be doing a particular innovative thing. Or sometimes first in Pennsylvania, or first in the country. And there's a couple of those. This is the first for Carbon County, and we're just so thrilled and excited to bring this higher level of care here. John mentioned in our vision that we want it to be very rare for patients to have to leave the county for care, and this is why. This is really one of those critical reasons why folks won't have to leave, and that's because we'll have the intensivists here at this hospital providing care 24 hours a day, 7 days a week in a critical care capacity. Along with that, we have a large emergency room, 30-bed. We will start with 17, and then we're literally starting construction as we speak to expand to 30. So the shell space is built, and we're building the inside to get to 30. We'll have a full interventional radiology suite. So again, building on that vision to provide the highest level of acuity to patients in Carbon County and beyond, we'll have full interventional radiology services. Along with that, and Dr. Markson appreciates this, is the all of our advanced cardiac services that we have available at this hospital, all the diagnostic services, certainly expertise in Dr. Bill Markson and his partners, but great and outstanding cardiac services. And then general surgery, we've recruited and done, I don't want to steal Dr. Markson's thunder here, but some of the best doctors in really in the country and in some cases in the world through their training and so forth. So we're really proud of that. And then all of these particular areas next, chest pain accreditation, stroke center accreditation, and then ultimately and most recently, level 4 trauma program accreditation that the team is very proud of. And we're happy to bring that higher level of care right here to our hospital and to the county. And then last but certainly not least in this slide is our fitness center. So we're going to have a 3,000 square foot fitness center available to the community, as well as to all of our employees and physicians and volunteers. We're offering actually a free 90-day membership. But as John mentioned, it's not just about taking care of the community from a quality perspective, as you see. We've done an amazing job of that, but it's also about promoting wellness and preventing disease. And the fitness center, we believe, will be a great step in that direction to help prevent disease and getting people active and exercising. Next slide, please, Alice. Thank you. So John mentioned this high tech, high touch. And here's where I'm going to talk about a lot of those firsts. And again, this is a real source of pride for us as an organization and all of us here at the campus level. LifeAir is first on this list, and I'm certainly not going to steal the thunder for Dr. Warlow because we're really proud of this partnership, and she's going to talk a lot more specifically about what LifeAir is and what it means for our new building. But I will talk about MediSigns and some of the other items and advances on this slide. MediSigns is really cool. It's the picture on the lower left there. It was in the video as well. And it's a electronic whiteboard. So very advanced technology. In past hospitals, nurses had to fill out whiteboards. They were handwritten, and it's often very laborious for a nursing team to have to do it. This is electronically fed from our electronic medical record, and provides the patient and their visitors with updates on their care, on the patient's care, as well as the care team itself. It's displayed as a constant in the room. And, again, it helps improve outcomes, keeps patients informed as well as visitors. So we're really happy to have that as part of it, as part of our new hospital. We have we have 2 CT scanners in our hospital. As we say in the ED world, time loss is brain loss. So having that second CT scanner is just makes a world of difference for folks in the EMS community and the folks in the community that may have a stroke or a ruling out stroke, to be able to have access to that CT scanner right away and have 2, one available for inpatients and outpatients, and a second for the ED. Was just again a great addition for us. I talked about the ED expansion. Virtual care, this is a first for us and in the country here. We partnered with a company called Amwell to provide virtual care, and you see the picture there in the middle there, and the bottom. That's this 55-inch high definition televisions and cameras that literally can zoom in on a patient's pupil in every room in our building. So we could really zoom in any doctor in the country or at our wonderful network. But not only that, there's another application here, and that's for patients and their loved ones. Oftentimes with COVID or other situations where the patient and their family members were separated, now we can literally zoom in a patient family member from anywhere in the country and have them be part of their loved one's care and care coordination. So we're just thrilled about that partnership as well. I talked about the fitness center, and these are just the next couple here are just the healing gardens and walking trails. I mentioned the 110 acres of land that we have, and we're going to make great use out of it. We want to really make this place, this hospital, a destination. And we're going to do that through some beautiful walking trails. We've partnered with some local wildland places, and we're going to have butterfly gardens, healing gardens, playground, natural playgrounds as they call it. So we're excited about that. We're going to have a tech bar inside our hospital. Think of it as a genius bar for the community. So we'll help the community be able to connect to their electronic medical records and have wearables to sell there, and also, so very innovative. And then ultimately an app for the community to order food from our Rick's Cafe, not your typical hospital cafeteria anymore, but rather a restaurant inside of our hospital that we hope the community will enjoy and access. Next slide, please. So this is our already, we haven't even finished, we haven't even opened yet, and we're expanding already. So we are so thrilled to announce that we have a 60,000 square foot medical office building that is underway. And as you can see there in the rendering, the hospital is on the right, and this beautiful new building will be on the left. And if you can go to the next slide, Alice, please. I'll talk about so inside of this building, we'll have a complete and cancer center. We'll have radiation oncology, the infusion services that we have here in Lehighton. We'll move over to this beautiful new building. We'll have all of the doctors and specialists there to support our oncology services, as well as our cardiologists, all of the diagnostic cardiology services, as you can see there, wound care, lab, beautiful women's imaging center, highest and latest in technology. Our fitness center will move here, as will our PT and all the other services in between. Next slide, please. So we don't want to forget about our Lehighton campus, and I'd be remiss if I didn't say that the Lehighton campus is equally important for our future and our vision for that future. We've invested heavily in human resources as well as capital resources to improve the buildings and make them spectacular. So we've broken this out into two phases. I just wanted our community and the folks on this phone to know what's happening back here, because it is exciting. So phase one, this is before the Carbon Medical Office building is finished, and we expect, as I said, we're starting already, and we'll finish in probably a year or so. But before that, we'll have all of our outpatient services still back here at the Lehighton campus, including women's imaging, the infusion center, and all those areas you see on this slide, including our skilled nursing unit, our Summit nursing home, our inpatient rehab, and our 2 behavioral health units as well. In addition to that, we'll have we'll consolidate our outpatient services for behavioral health, and then we're going to offer the first of its kind, really in our region and expanded region, I will say, in having behavioral health walk-in center. We'll have access to behavioral health services 24/7 in this building, and it's just going to be again, everybody we talk to, we know how important and how much of a need there is for mental health and taking care of this community. So we're going to get started working on that right after we move in the end of November to the new hospital, and we'll hopefully have those available this coming summer. We'll open up the first of its kind behavioral health walk-in center here at the Lehighton campus for the community. On phase two, all those other services I just mentioned will remain. We'll expand our behavioral health services to include dual diagnosis, and we'll utilize the rest of the building for clinical education. So that's my update, and I get to turn it over to Dr. Markson. Thank you.
Thanks, Joe, and for that update. And Thanks, Alice, for thank you for the chamber for having me. You know, I've been a physician in this community for 32 years. It's really hard for me to say that number. And when I first arrived with a full head of curly hair, they called me Doogie Howser. I'm also glad you're all muted, so you can't laugh at that. But, you know, I thought I came here properly trained to take care of heart disease. But over time, I learned that it's even more important to take care of patients and families, not just the condition. I also realized that in addition to the amazing things that modern medicine can offer, treatment and testing can be a real burden. And burden can be financial, can be related to side effects, loss of dignity, time, and feeling like you're adding to your own family's stress. And I can't help but think back over the years of so many patients and families arranging distant rides for surgery, special x-rays, pre-op evaluations, incalculable hours in waiting rooms, away from home, awaiting completion of medical tasks. To me, the biggest investment St. Luke's has made, the most important one, is not even in the hospital, but it's in hiring high quality, caring medical providers that are based right here in Carbon County. This is already and will continue to truly elevate care and diminish the burden of care. Less burdensome care is and will lead to proper and better care. This first slide shows the distribution of some of our primary care practice locations. There's 16 of them and represents more than 45 providers, most of whom are new since St. Luke's took over from Blue Mountain. If you could go to the next slide. So I want to give you a little bit of a virtual tour of our providers, because these are real people. First I want to, I'm not going to name everyone here, but I just want to highlight in Palmerton, Dr. Patty Donovan, Britta Hansen, Bethany Lengel, and Sally Wemple. And in our Perryville office, Eric Cochran, Joe McGinley, Priya Patel, and Catherine Santoli. All of these physicians and advanced practitioners are new, apart from Joe McGinley, since St. Luke's took over. And they are really doing a great job. They're bright and they're earnest. You know, before St. Luke's took over, I commonly saw patients leaving the area simply for primary care. And now that's really quite rare. I want to also call your attention in the upper right of this picture to, I'm going to mention a few specialists. Ali Butash is on the upper right. So she's our newest surgeon. She joined us this summer. In addition to being a general surgeon, she's a cancer specialist. And she played she's got a great story. She played softball for Lehigh. She went to Jefferson Medical School, did her general surgery training at Beth Israel Deaconess, which is a Harvard hospital, and then went to Roswell Park in Buffalo for cancer training. And already since the summer, she's performed surgery right here in Lehighton for breast cancer, head and neck cancer, and colon cancer. If you could advance to the next slide, please. I also wanted to call attention to Remy Mims, which he's in the middle on the top. And Remy is an endocrinologist. Endocrinologists are diabetes specialists. And diabetes care has become so expensive and so complicated with many medications, pumps, monitors that are proper for some, but really aren't proper for everyone. A lot of judgment is needed. And better care for diabetic patients is so important at preventing complications. The highest level of care wasn't always provided in Carbon County, and patients had to travel frequently to Allentown, Bethlehem, Center Valley to see endocrinologists for this higher level care. They had long wait times for appointments. Remy's now here and ready to take care of people. He trained in endocrinology at Temple, and even more important than where he trained, he's really a super nice person. He's caring. He presented to our local provider journal club last month on diabetes medications, and he was really well received. And we really had a lot of shared learning with Remy, which was great. So Remy, Allie, and all these other physicians and advanced practitioners that you see are super well trained. They're caring, they're kind, and they are 100% based here in our community. They're not here with their arm twisted behind their back, waiting for another opportunity for something better. They think this is the great place to practice, and we are really so glad. So I'm really excited about our new hospital, but I'm even more excited about our terrific new medical providers that care and will continue to care for our community. So if you go to the next slide, that just shows another list, a comprehensive list of specialties that are based right here in Carbon County and routinely available to provide care. So thank you for listening to me.
Thank you, Dr. Markson. I'm Catherine C. Worlow, founder and CEO of LifeAir Systems, and I'm really honored to be here and to be speaking with you. And Alice, it might be best just to begin with the video overview. Alice, are you able to start the video?
LifeAir Systems was designed in response to an absence of a solution after we learned the significance of air quality on patient care. Much to our surprise, there was nothing commercially available to deliver the airborne metrics we knew were so critical to our success and to the delivery of the highest level of patient care. Once we realized these metrics, we literally worked backwards and designed a system that would deliver those metrics without producing byproducts and would do so in a single pass of air. And what I mean by that is any infectious bacteria, viruses, or fungi that enter the system will not exit. Whereas a lot of technologies, the air needs to go through 5, 10, 20, 30 times. So that was very important to us.
We were fortunate to collaborate with LifeAir on a clinical study. The initial series of studies showed that LifeAir effectively eliminates a lot of the contaminants, bacteria, viruses, fungi from the air and by proxy from surfaces around patient rooms and the hospital. The second study actually looked at how this might affect patient outcomes. And what we found is that patients were able to go home sooner and they overall did better.
It's already been demonstrated in a study involving over 8,000 adult med-surg patients, now published in a peer-reviewed healthcare journal, that by removing all airborne infectious pathogens and dramatically reducing surface, that the length of stay was decreased by 39%. It also demonstrated a reduction in HAIs, or healthcare-acquired infections, and improved discharge outcomes and significant cost savings. In a second clinical study that we've conducted, the staff illness was dramatically reduced and staff call-outs were dramatically reduced. So you're really sending a very strong message of protection, not only for the patients, but also for the staff.
I believe that we have a solid foundation for future growth. Together, we've been able to create a lot of opportunities to improve patient care. And I think this is only likely to grow. We hope to be doing more research with LifeAir because there are many, many questions that remain to be answered in this important area. It's really a brand new area of research. No one's ever looked at quality of air in hospitals, unless it was something really bad. Now we're looking at taking good to great, and I think that's what LifeAir's all about.
Of course, our goal is to make the St. Luke's Carbon Campus one of the safest hospitals in the country. LifeAir is certainly consistent with that theme. LifeAir, it's not just an air filtration system. It kills COVID. It kills other viruses. It kills other pathogens in the air. And we'll have the presence of this miraculous technology throughout all patient care areas. It's incredible.
Thank you, Alice. It's really an honor to participate not only in this great event of celebration, but also in the vision of excellence across all sectors of patient care associated with one of the most innovative and forward-thinking hospitals, St. Luke's Carbon County. Our vision at LifeAir Systems began well over 20 years ago when we realized the significance of airborne bacteria, viruses, mold, and chemical pathogens on the successful growth of the human embryo during in vitro fertilization. I was literally given a blank check, the only one of my life, by our administration, specifically to purchase an induct, in other words, in the duct above the ceiling or on the rooftop, an induct air purification system that would deliver the air quality we had learned over a 15-year period of intensive research, the air quality that we now knew was so critical to the level of patient care that we could offer. I was shocked. I couldn't use the check. There was nothing I could commercially purchase as a clinical provider that would adequately protect our clinical space from airborne pathogens. This was personally and professionally unacceptable. The level of care that we could offer our patients was dramatically and negatively impacted by something we couldn't even see, the air and its complex components. The absence of a solution to purify the air to the point we now knew we needed for optimal patient care. The absence of a solution led to the genesis of the LifeAir system, a transformational air purification system that destroys. It doesn't capture, it doesn't filter, it destroys and removes all infectious airborne bacteria, viruses, fungi or mold, and chemical pathogens. Because the system's technology was originally designed to protect the human embryo, the bar, the design bar, if you will, was set extraordinarily high, the results of which are now offering a paradigm shift in air purification in the healthcare setting. Alice, next slide, please. Technology overview. The technology is purposed, it's proven, and it's patented. What makes the technology unique is that it delivers comprehensive destruction or removal, again, of all infectious airborne bacteria, viruses, mold, and chemical pathogens. But it does so on a single pass. It was critical that what entered our system infectious was destroyed and did not enter the clinical spaces being protected. Secondly, we chose the anthrax spore as our target for destruction, not because we were concerned with anthrax, but because it is the most difficult biological to kill. Again, the bar was set very high. So as the kill effectiveness was actually tested by the National Homeland Security Research Center, and because our system delivers an anthrax kill, it actually provides what's referred to as a 9-log remediation. 6 log is sterility, so 3 logs more aggressive than sterility. A 9-log remediation of all other infectious bacteria, viruses, and fungi that do concern us in healthcare, including but not limited to C. diff, MRSA, pneumonia, influenza, staph, strep, and absolutely COVID-19 and its variants. We wanted this protection to be delivered 24/7 during live operation within the clinical spaces, no matter what the activities were in that space. And finally, it was critical to us that the technology deliver this excellence without producing byproducts, and that the system be supported by multiple robust clinical studies. We are very proud to be an evidence-based technology company and within the Lehigh Valley. Alice, next slide, please. The combination of what our technology delivers, the comprehensive destruction of all infectious pathogens in the air, and the fact that of those pathogens that cause healthcare acquired illness or infection, of those pathogens that cause these infections, 69 to 80% are airborne. 69 to 80%. Fact number 2, of the infectious pathogens on the surfaces, your bedside table, the counter in the patient room, 90% originate from the air. Now, healthcare-acquired infections represent a significant clinical and economic issue in our healthcare system within the United States. So the combination of a technology that offers a paradigm shift in air purification and the persistence of healthcare-acquired illness and infections led to multiple large clinical studies. Next slide, please, Alice. One of which was conducted with St. Luke's, to which Dr. Stawicki referred, where clinical outcomes were compared between 2 floors at full patient capacity. And as stated, over 8,300 adult patients were included in these studies. The studies compared one clinical floor protected by traditional HEPA filtration to a second clinical floor protected by the LifeAir technology. The results were both statistically significant and offered a paradigm shift in the significance of the air surrounding our clinical areas, patients, visitors, procedures. Next slide, please. Monthly environmental testing of the air and of the most commonly touched surfaces within each patient room, occupied, operational patient room, over a 12 and 15-month period in each of 2 independent studies, demonstrated that the patient rooms protected by the LifeAir technology demonstrated greater than a 99% decrease in airborne bacterial, viral, and fungal loading, and a 97% decrease in infectious surface loading. Again, 90% of what lands on the surface originates from the air. By removing all infectious airborne pathogens during live operation, this is key, patients, staff, visitors shedding viral particles by breathing, talking, sneezing, coughing, flushing, singing if the moment strikes. By removing all infectious airborne pathogens and dramatically reducing infectious surface pathogens, 2 very common sources or vectors of illness were removed or reduced. The results of which included, next slide, please, a trending reduction in healthcare-acquired illness and infection, as well as readmission rates, a statistically significant improvement in patient discharge outcomes to their homes, and a 39% reduction in length of stay. Patients were going home sooner, which drove a cost savings of 23% to the hospital. Next slide, please. In addition to the significant clinical and economic impact, there was also the high level of comfort and confidence, knowing that the patients, the staff, and the visitors specific to the floor protected by the LifeAir technology were also being protected from both common and new infectious airborne viruses. Again, as the system was designed and proven to kill the anthrax spore, it provides an exceptionally high level of kill towards the more common bacteria, viruses, and mold with which we are concerned. Next slide, please. We are honored that this purposed and proven technology has been installed and is now operational to protect your ORs. Next slide. Your PACU. Next slide. Medical surgical floor. Next slide. And your intensive care unit at the St. Luke's Carbon Campus. Again, the installation of the LifeAir technology is consistent with the innovative vision towards excellence in patient care, as clearly demonstrated by the clinical providers, staff, engineers, project managers, and leaders at St. Luke's. Next slide, please. St. Luke's is not only the first in our great state of Pennsylvania, but is completely unique in that it has chosen to protect all acute care areas in its Carbon County Hospital and joins other leading healthcare providers in the United States in offering a transformational technology that impacts care across a continuum. Next slide, please. Across a continuum, beginning with our genesis and absolute determination to protect the human embryo, to the reduction in infections, readmission, and length of stay in the acute care setting, and finally to the reduction of illness and infections towards improved quality of life and wellness in senior living. We are honored to both impact patient care and wellness across a continuum of care, as well as be part of one of the most innovative and forward-thinking hospitals in our region, our state, and our country. Here for only one reason: to serve each of you in Carbon County. I thank you.
Thank you so much, Dr. Worlio, Dr. Markson, Joe Pinto, and John Nestle for the wonderful presentation this afternoon. If anyone has any questions, we ask that you use the question and answer box, and we will be sure to ask them of our panelists. I did want to take this moment to give a little plug to a few chamber events coming up while we await a few more questions. On November 10th at the Bethlehem Wind Creek Center, we do have the Chamber's annual meeting. And on November 12th at Blue Mountain Resort, the Carbon Chamber and Economic Development will host its annual awards ceremony. You can register for both of those events on our website, carboncountychamber.org. So at this time, we do have a few questions in the chat box. I am going to address them to John, and you can have any of the staff answer them that you would like. So we have a message from Murtaza that says, thank you for everything that St. Luke's does in our community. Are there any plans in the future to develop a transplant center?
You know, Alice, if I may, I see the second question as well. They're kind of related. And let me read the second question, if I may. How can we be sure all of this state-of-the-art expenses won't be passed on to patients, making its care inaccessible because of cost, particularly for our areas most vulnerable? And a couple, two-pronged answer to that. First, St. Luke's, again, in all my travels over the years, has the most caring approach to care for the vulnerable and the underinsured or uninsured. So care is provided regardless of ability to pay. That's an axiom here. That's just a given. And that includes the most vulnerable, of course. I mean, we have community outreach programs for so many populations that are struggling economically and socially and otherwise. And then the second question on transplantation, it kind of relates to the other way we believe we can best keep costs under control is to have a healthy community. And, certainly we want the highest level of medical care, but, we're just as committed the major causes of death in this country or morbidity, affecting quality of life, diabetes, heart disease. These are both diseases that can be prevented or even managed or delayed if the right care is given at the right time. Cancer, obviously early detection, screening, critical. Behavioral health and addiction, suicides, sadly, are in the top 10 in the cause of death. And infectious disease. Obviously, Dr. Worrell just gave a great presentation on our commitment to infectious disease and then stroke. So those are the areas of emphasis, and we are the best in all those areas, not only in caring for those diseases once they exist, but just really passionate about being out in the community to prevent or manage effectively to keep people out of the hospital. And that includes not just the physical health, like heart and lung and diabetes. It does include mental health. And Joe Pinto talked about this walk-in center at the existing Lehighton campus for behavioral health that we will be opening. Sadly, we have one of the highest veterans populations in particular in the state, and one of the highest suicide rates of vets. And so we intend to bring the Veterans Administration into the building for it, where they have educational programs, but really for all patients in the area, to get out in front of mental health and to stabilize it. It can be managed just like every other disease, every other pathology. So that is what we're all about, preventing disease and minimizing the impact of once disease takes hold on the quality of life. The transplant question, as I said earlier, 99% of healthcare will be provided locally, but transplantation, who knows long-term? I don't rule anything out, but less than 1 out of 50,000 people has a transplant in any given year. Those are the latest numbers I saw recently. So even taking care of a population of 200,000, it is not cost effective to do transplantation. Now who knows? Long term, it may become more prevalent. It may become less expensive. Who knows what the future holds with the advancement of technology? But that's that 1% that probably belongs in a population serving millions of people until the technology evolves further.
Thank you so much, John. We do have a few more questions that have popped up into the chat box. The next question is, how far is the campus going to spread? And I believe that is the area in which the campus will cover there in Franklin Township.
Joe, do you want to take that on?
Yeah, I'd love to. So as you saw in my part of the presentation, we're already spreading. So we have plans. Our master plan is as I'll call it, really has us continuing along the main drag there. So as we build the medical office building, as you saw in the picture, the next building would continue next to that. So I guess the answer is we'll continue developing the land as our needs grow. It wouldn't surprise us the way we're building the medical office building. We're building it in such a way that it could have dual capability. We're building it to hospital grade. So for folks on this call, what that means is that down the road, if we need to expand our hospital and create more patient care rooms or whatnot, we'll be able to utilize that space and build a second medical office building adjacent to that. So it wouldn't surprise me if the campus continues to spread in the way that it's already being done, as I showed in that photo, down the pathway that it's expanding.
Great. Thank you so much, Joe. Our next question looks like it's for Dr. Worlio. It's 2 parts. Is St. Luke's University Health Network the first hospital system in Northeast Pennsylvania to use LifeAir? And do you foresee this having other applications in technology outside of the healthcare system?
So yes, St. Luke's Carbon County is not only the first in Northeast PA, but it's the first in Pennsylvania, and actually the first in the United States to provide this level of protection across all acute care areas. So this is significant. It really is. Relative to other applications, as I mentioned, our second large clinical study, which really the data somewhat mirrored what we found in our healthcare study with St. Luke's, was specific to senior living, and where we saw a dramatic reduction in healthcare acquired infections or facility acquired infections at the residential level. So senior living is another area where we're literally just putting together that manuscript for publication. Given we're very healthcare centric as a company, just based upon our genesis. As a result of the pandemic, we have had a great deal of calls from non-healthcare centric areas, commercial office spaces, airports, Broadway theaters, et cetera. So we've tried to pivot as a company and help where we can, just to help people get through this. And we will indeed get through this. So no, we're very proud to be associated with St. Luke's Carbon Campus.
Thank you so much, Dr. Werlio. With that, there are no further questions in our chat box. I did want to just ask John for any parting thoughts before we go ahead and end the program for today.
Well, again, I want to thank you, Alice, and the Chamber. And by the way, Alice is providing great leadership to the Chamber. I mean, she's just fantastic at the network development, understanding the needs of the community, just a really balanced approach to economic development. So we're very lucky to have you, Alice, leading our Chamber.
Thank you, John.
You're welcome. But beyond that, I hope we gave the community a good sense of the incredibly bright future for Carbon County, and honestly, not just in healthcare, but in all aspects of life. I think wellness, prevention, education, and economic growth. The future is really bright, I think, in the greater Carbon County region. Thank you.
Thank you so much. And thank you to our audience for joining us today. We appreciate you taking the time to be with us virtually and hope that you enjoyed today's presentation, as John said. Thank you so much to our presenters for taking your time and your expertise that you are bringing here to Carbon County. We look forward to sharing your opening on November 20th with the entire region here in Carbon County, the Lehigh Valley, and beyond. Please be sure to check the Chamber's Facebook and Instagram pages for more upcoming events and details about the opening on November 20th. On behalf of everyone here at the CCEDC, we hope you and your loved ones stay safe and stay healthy, and thank you for joining us. Have a great rest of your afternoon. Bye-bye.
Thank you.
Bye, everybody.
Bye-bye.